putting North Dakota first.
Welcome back, and for tonight's KX Conversation, we welcome Pamela Sagness. She's the director of our state's Human Services Behavioral Health Division.
Pamela, thanks for joining us.
Hi, thanks for having me.
May is Mental Health Month, and this year the Behavioral Health Division has awarded 10 grants for a specific purpose. Tell us about that.
Absolutely. We've awarded 10 grants. We actually had 32 applicants, so excited to be announcing today the awards for implementing suicide prevention at the local level. Communities, whether they were groups or different providers, were able to submit applications to address prevention needs for suicide in their local community, and those awards are being announced today. Just over $500,000 worth of awards for local communities.
That's pretty great. And as far as awareness goes, I think North Dakota's made huge strides, but where do we still need some work?
I think the key thing that we're continuing to work on is just awareness of mental health as a positive thing, that wellness and well-being are key. We need to continue working to end the stigma that's around mental health and addiction and focusing on just wellness. I think we've all been impacted over the past year from the pandemic and all of the things that are impacting our lives every day, that it's important to take care of ourselves and to really support others who are supporting individuals that have potentially had concerns around suicide or completion of suicide, so that we care for family members and those also impacted.
So how concrete are we as far as numbers goes? Tell us about that.
Absolutely. We know that according to the Vital Records data, we have seen in 2020 146 North Dakotans that died by suicide. We also know that the young population between the ages of 15 and 34 see some of the higher rates. I think it was the second leading cause of death among that age group. And so it's important that we continue to focus on those at risk for suicide, knowing what effective prevention is, and not being afraid to ask questions, to engage and really have the conversation around, is everyone okay, and what our needs might be.
And I think most importantly, for anyone that needs help or for somebody who knows somebody that needs help, what do we do?
Absolutely. So I think there's a couple of things. We have information on our website at behavioralhealth.nd.gov if you're interested in being involved in suicide prevention and being part of that effort. But if you're struggling or know someone who is, to also call the National Suicide Prevention Lifeline, which is 1-800-273-TALK. That's 1-800-273-8255.
Pamela, thanks so much for your time.
Thank you.